Heart attack symptoms. Symptoms of a heart attack include discomfort, pressure, heaviness, tightness, squeezing, or pain in your chest, arm, or below your breastbone. Discomfort that goes into your back, jaw, throat, or arm. Fullness, indigestion, or a choking feeling. It may feel like heartburn. Sweating, upset stomach, vomiting, or dizziness. Serious weakness, anxiety, fatigue, or shortness of breath. Fast or uneven heartbeat, heart palpitations. Anxiety. Heart attack symptoms can be different from person to person or from one heart attack to another. Women and people assigned female at birth are more likely to have these heart attack symptoms. Unusual fatigue, shortness of breath, nausea or vomiting, dizziness or lightheadedness, discomfort in your gut, may feel like indigestion, discomfort in the neck, shoulder, or upper back, trouble sleeping. With some heart attacks, you won't notice any symptoms, a silent myocardial infarction. This is more common in people who have diabetes. Why does a person have a heart attack? If we ask ourselves this question and read and follow what is written, we can probably protect ourselves from this danger. Heart attacks are more common in people who do not move much, who smoke and drink alcohol, who are obese, who have high blood clotting for a long time, who constantly eat fatty foods, and who use a lot of margarine. The amount of cholesterol and lipids in the blood of most people who have had a heart attack is higher than normal, and the blood of such people tends to thicken. Sometimes patients suspect a heart attack because of any pain in the chest area and evaluate stomach and esophagus pain as a heart attack. It is important to take an urgent cardiogram to make an accurate diagnosis of the patient. In addition to the feeling of heaviness in the heart, patients constantly complain of lack of air and burning pain in the chest. In general, every person should have a cardiogram of the heart once in 2 years and use herbal teas that rinse the blood, give up dark black tea, dark coffee, and walk at least 5 kilometers every day. It is better to eat a salad made of cabbage, carrots, beets, and olive oil with wholemeal bread before every meal, and to eat plenty of seasonal fruits and vegetables. One of the useful ways to protect against heart attacks and ischemic heart diseases is to drink at least 1 liter of raw water a day. The normalization of water circulation is an indispensable blessing for the nutrition of all our tissues. The tea, fruit juices, and other beverages we drink do not belong to water. Another way to prevent a heart attack is not to get angry. Nervousness is the main factor that causes a heart attack. Tea to prevent heart attacks. 100 grams of each of corn flour, rosemary, honey mint, and linden plants are taken. Then 1 teaspoon of each of these plants is taken, brewed in 3 cups of water for 20 minutes, filtered and poured into a thermos, and 1 cup is drunk before meals 3 times a day. Take 100 grams of each of cachemboule, cherry stem, hawthorn flower, and rosehip fruit. Then take 1 full teaspoon of each of these plants. Steep in 3 cups of water for 20 minutes. Filter and pour into a thermos. Drink 1 cup before meals 3 times a day. 100 grams of each of hawthorn fruit, damotu, honeysuckle, and mullein plants are taken. Then 1 full teaspoon of each is brewed in 3 cups of water for 20 minutes, filtered and poured into a thermos, and 1 cup is drunk 3 times a day before meals. To protect against heart attack, you need to brew 2 medium tablespoons of hawthorn fruit in 3 cups of water and drink 1 cup 1 hour before meals 3 times a day. I reminded that hawthorn also lowers blood pressure. If the blood pressure is too low, reduce the dose of hawthorn, for example, 1 tablespoon, or mix honey before drinking the infusion. In addition, performing 8 to 10 pieces of hijama 4 times a year and applying 42 pieces of leeches twice a year, 6 pieces every 10 days, rinses the blood and improves the blood circulation of the heart.